Welcome. This is Just Breathe, Breathing for Rehabilitation and Performance. My name is Louise Pinkerton. I'm a clinical assistant professor at the University of Iowa. That's one of my disclosures. My other disclosures are that I'm certified in LSVT Loud and Speak Out, both of which I will briefly mention during today's program. This program was put together after starting to work with graduate students in speech-language pathology and in voice. And one of the things I observed is that, with the exception of those that had experience with acting or singing or performing of some sort, people had didactic knowledge about breathing, but they really weren't able to necessarily perform breathing or demonstrate it well, or even really broadly think about how we use breath in a clinical setting. So what we're going to do today is we're going to go through different ways that we use breathing. The first one's going to be to regulate our emotions or our arousal states. The next way is how we illustrate how breathing works or educate people and help them develop kind of a kinesthetic awareness of their own breathing. Then we'll look at breathing as a tool for managing voice and upper airway disorders, as well as other disorders we don't typically think of as associated with breathing. And then we'll talk about some of the ideas I've developed about the speaking and singing voice as I transitioned from being a singer and voice teacher to being a speech-language pathologist. Of course, alignment is very important with breathing. So the first thing we're going to start with today is the big T, just to get us going. So arms straight up in the air, to the side, and down. And since I haven't mentioned it before, we'll all be doing most of these together. So feel free, as I'm explaining things, to try them out, especially if you're at home, and just give it a go, even if I don't cue you to do so. So let's first talk about using breathing to regulate emotion. So let's start together by doing a color breathing meditation. And if you'd like to close your eyes, you're welcome to do so. So close your eyes if you're comfortable. And I'd like you to breathe in and out slowly. As you're breathing in, notice where your breath goes. Feel that the breath easily comes in through your nose, down your throat, and into your lungs or into your abdomen. As you're taking this easy breath in and out, imagine that the breath is a beautiful color. This is your favorite color in the whole world. It's a color that makes you feel good, confident, comfortable. And as you breathe, the air comes in and fills your lungs with that color. It's a warm, molten feeling, almost like warm lava. And as you keep breathing in your center, around your belly button, you're going to feel that warm, molten color create a ball of energy. So you breathe in and you add energy to that ball. Now as you breathe in, that warm, molten energy is going to spill over and go down and fill your legs from the toes, through your ankles, your knees, up to your hips. Feel this warm, beautiful color throughout your lower body. With the next breath, that central ball spills over and fills your torso from the bottom all the way up to your shoulders, and you just feel warm and relaxed and easy. All of your muscles are warm and bathed in this beautiful color. With the next breath, it's going to flow down our shoulders, out, and fill each individual finger, and then up the rest of the arm. And then with each breath, we continue to fill our body up through our neck with that warm, relaxing color, through our head and our face, and we're all full of that warm, molten, beautiful, comfortable color as we're still doing our steady breaths in and out. Keep breathing and listen. When I say it's time, you're going to take a slow breath and then you're going to blow it all out as fast as you can. And if you've had your eyes closed, you're going to open it. So breathe in slowly and let it all out. Great. So this is an example of something I might use at the beginning of the session if it helps the client get in a better state of mind. Definitely used it in singing lessons when somebody's gotten really anxious at any part of the lesson. And this uses two aspects of breathing that we can take advantage of related to our autonomic system. So one of the reasons I really like that meditation or that breathing exercise is it connects people with their whole body as well as their breathing. Because we've got a balanced breathing ratio, or sometimes even a longer exhale, we get a relaxing feeling. It activates a part of our autonomic nervous system that calms us down and helps us feel comfortable. You can add phonemes or sounds to the exhale as well, which we'll talk about more, helps it be applicable to speech and singing. Right now, we're just using it for mindfulness. And the very last part of it, we have a longer inhalation and a shorter exhalation. And that actually activates the opposite aspect of our autonomic nervous system and gets us energized or alert. So I like that it combines bringing people, calming them, but then getting the energy up for what you need to do. We can certainly isolate either of those activities and not do them in combination. Doing a yoga alternate nasal breathing can be a really good one for getting that nice calming sensation, or just doing counting breathing where it's 2 to 1. You inhale 2, you exhale 4. You inhale 4, you exhale 8. Another way to do the short exercise is a sniff hiss or a snuff hiss exercise. It's from How to Teach Voice and Communication Skills to Transgender Women. And what you do is you do 3 quick sniffs, feeling an expansion in your abdomen, and then you blow all the air out on a hiss. So let's try that together. Again. Okay, so we get that air right out, and a short exhale and get our energy going. It's also great for us to be teaching these strategies to our patients and clients, because then they can self-manage their own anxiety or stage fright when they're in situations where those emotions are going to interfere with what they're trying to accomplish as a speaker or a singer. So the next thing we're going to talk about is building kinesthetic awareness of breathing. So illustrating how breathing works, helping people correct their body maps of what happens with breathing, and helping them get the sensation of what we're looking for. This is very early introduction to a new motor skill, so people aren't going to be perfect right away. And it's okay if they're making mistakes. You don't need to coach somebody to be perfect in that lesson or in that session. What you need is for them to understand the idea or the exploration and then be able to go keep working on it themselves. So sometimes I will do hands-on, like putting hands on my ribs or the sides or the belly or the shoulders. Generally, I have clients or students touching themselves. When I first started voice teaching, it was much more common that the teacher would come in and touch people. I think we've moved away from that, and I think that's probably a good thing. If I do feel like I need to touch somebody, I usually have them put their hands, for example, on their belly button first, and then I'll put my hand on top of it. I might touch somebody's shoulders without their hand being there, but I'm definitely going to ask and make sure people know what I'm going to do before I do anything. So this is about exploration. This is about self-discovery. It's not necessarily about building or improving voice skills at this moment. So when we explore breathing, we can certainly do it standing or sitting, which is often our options when we're in a clinical setting. If you have a table, you could have people lie on their back or lie on their stomach. We need to keep in mind, though, that long-term work on the back or the stomach is going to be different than the breathing somebody would do standing or sitting. So we can use that for illustrations, but don't want to spend too much time there. Oftentimes, I start by briefly explaining to people how breathing works, and then we go into trying different things and observing what happens in the body. So I'll give you part of my spiel, and I'll jump in and out of it as we go. So when we think about breathing, we want to think about the air coming into our lungs. And, a lot of people have different ideas about where the lungs actually are, and they go to about the bottom of our ribs. So if you take your fingers down your side, find your bottom rib, okay? Your lungs are about that far down, okay? And you may wonder then why you feel it down here, or why we encourage abdominal breathing, or sometimes people call it diaphragmatic breathing. That's because your diaphragm's involved in it. We'll talk about its job in just a second. But the lungs are way up here. They're in your chest. They're protected by your ribs, because that's what your ribs' job is. So when we breathe in, the lungs don't actually move, because they're just kind of these sacs of tissue. What happens is that diaphragm, that's a muscle of inhalation, contracts. And so the diaphragm secures from our spine and back, around the sides of our ribs, and up. And it makes this dome-shaped muscle. When we breathe in, it contracts, and the lungs are going to come down with it, okay? So they're very passive. It's the diaphragm. There we go. Now take a breath in and tell me if you can feel the diaphragm. Yeah, you can't. You can feel the things that happen, the ribs expanding, the belly moving, but you don't feel the diaphragm. So we probably won't talk about it much at all after this. What you do feel, though, is, again, the belly expands and the ribs expand. So let's play with that a little bit. So put your hands on your belly button and take a breath in. Good. Did you feel your belly move? By the way, you should be doing this along with us, just exploring, okay? Yeah, so take a breath and really sip it in and try and feel that belly expand. And let it go. A sipping breath or a straw breath can sometimes help people feel that lower expansion, okay? And what I might say next is, yeah, our belly has to expand, because when the diaphragm contracts, everything underneath it gets pushed down, and the only place it can go is out. So we get that belly or abdominal expansion.
Now, individuals that are very athletic or into dance, or just have gone through the American ideal of we have nice tight abs and a strong structured core, may have difficulty with this, or people that just aren't very kinesthetically aware. What you can do then is, that's where potentially lying on their back with the book on their belly, or lying on their stomach and feeling their whole body move, or even leaning against the edge of a piano and feeling that they move away from the piano as they breathe, can be helpful. You can also do some panting to try and get that feeling. You can pant with the upper as well as the abdominals. You're doing a quick inhale and exhale with those. Those can help build awareness. Okay, so we've got the feeling of a belly breath. We know that the diaphragm is something that we don't feel. Let's check out what happens to our ribs. So if you put your hands on your sides, take a breath and move your ribs. So what do you feel happening? Yeah, most people will notice that the ribs expand, especially if we have the hands on the lower ribs. You get that nice expansion. You can also have the hands open and feel a little bit more around. Okay? You can also put hands on the back, and let's take a breath and see if you feel anything in your lower back. Okay, what did people notice? Yeah, sometimes you feel expansion there. I usually only talk about the lower back in the beginning, for the idea that we feel expansion all the way around our body. The abdomen, the ribs all the way around, and the lower back. Really along our spine, we don't have a ton of expansion, but I like the image to give people of we breathe all the way around, and so we're here, and then we breathe and we open all the way. I found that that's an image that works pretty well for folks, but I don't make a big deal about back breathing. I will take some time, and we're going to play with clavicular breathing in just a moment, and breathing with the shoulders, but I'll leave it out in the beginning, and we'll explore that later. So the next exploration I like to do with people is figuring out that you don't have to work to bring a breath in. Many singers, many actors, they're so used to having to work on their breath that they have a habit of putting a lot of effort into it. And we want to reduce that. We want to help them figure out that, you get a partial vacuum in your lungs, and if you create the space, you will get a breath in. So what I usually have people do, and let me explain it first and then we'll try it, is they exhale, and when they're done with their exhale, ask them to tighten their abs up really tight, and then all they need to do is relax their abs. And as they relax their abs and create the space, the breath is going to drop in whether they think breathe or not. And usually, if their larynx is open and they're pretty relaxed, it'll be almost effortless. So let's try this. So blow all your air out and tighten your abs. Relax your abs. Okay. Did you feel it kind of just drop or fall in? What we want people to do then is it's not necessarily that you're going to keep doing this activity or that you need to do that before every singing phrase or speech, but the idea is to get the feeling and memorize that feeling of release or of drop or of ease. Okay? So we haven't talked about clavicular breathing or shoulders being involved. What we're going to do now is play with the idea of overfilling, and we're going to explore and help people notice that when you overfill, you get the upper chest involved and potentially the shoulders involved and a lot of tension. So what we're going to do is my directions would usually be, okay, I want you to breathe from your belly and fill your lungs up until you are completely full of air and you couldn't take anything more in. So, okay. When I reach that point, I reach kind of a nice fullness that for me would feel comfortable for singing or talking. And then when I breathe more in, I get the chest tight, I get the shoulders tight. So then we can talk about, well, what did you notice? You noticed the chest moving and maybe the shoulders moving. And was that easy or was there tension? So then we would compare that negative practice, what we don't want. Okay, so let's take a comfortable abdominal breath. So again, it's easy. We feel the abdomen move, we feel the ribs move, the upper chest is pretty stationary. Now for classical singing, there's a lot about having the sternum being lifted. You certainly can address that or talk about, if you have it too high, we've got that tension again. If you have it drop, you're crunched and you can't feel it. So again, depending on where the student's sternum is, you could do that kind of negative practice and exploration. I also like to explore nose breathing versus mouth breathing, just to have people really feel the difference. So let's take a nose breath, a comfortable nose breath, and release it. And let's compare that. Let's take a mouth breath. Okay. And then what did you notice? What's different between the two of them? Things people will notice is the speed. The nose breath takes longer. Sometimes people will feel that one breath or the other helps them get a more abdominal breath. Sometimes people will notice tension with one or the other. And so those are things you can talk about and you can work with as you're going through and again, guide them or shape what you need to change about their breathing. Another thing to do is to work with the idea of different size breaths. I know when I learned singing, it was all about you have to get the biggest breath you can to sing your phrase. Well, that makes sense as you're learning new breathing because I probably wasn't breathing and getting enough air and having enough support and apagio and all those classical terms we use. But if I were still trying to sing now, many years later, taking the biggest breath I possibly could, what it would do is add tension. And I think at the time it added tension too, because you want your breath to match the phrase. And we'll look at that with some exercises later. But a short answer for people just exploring it is they take a breath to just say the phrase, hi, how are you? So let's try it. Hi, how are you? Good. Now take the breath to say, hi, how are you really loud. Hi, how are you? We take a bigger breath, right? Because we have more demands. Or let's take a breath to say, hi, how are you? I'm doing really fine and it is so great to see you. Take that breath. Hi, how are you? I am doing just fine and it is so great to see you. We take different breaths for different needs. And again, people can observe, oh, when I go to take the long or do the long phrase, maybe we have more tension. Or, oh, when I went to do the short phrase, I took this huge breath I didn't need. Again, exploration, helping people build a kinesthetic sense of what's going on with their breathing, what they feel. And the goal here, again, is not to give them specific directions, as in I want you to take a big breath, but the idea of exploring and finding where that comfortable abdominal breath is with a little rib expansion. And I should mention, my background is primarily in classical singing. I've done some musical theater and I've done lots of lessons and trainings in contemporary commercial styles. So some of the things I'm saying might be standard for classical breathing. You may find that for therapy or for the people you work with, you want to tweak those ideas or use them differently. That is perfectly fine. The last thing I want to explore with this is the idea of taking a big breath versus taking a breath to do something. So we're going to take a big breath and then hold ah out as long as we can. Kind of a speaking ah, if you've done LSBT loud like that. Okay? So take the biggest breath you can and say ah as long as you can. And I'll wait for those of you that are still going. Okay. So again, that was a very physical instruction. We were focused on the breath. What I want to do now is I want you to sing that or speak that for 12 counts. Okay, ready? Great. I don't know about you, but I was much less tense when I took the breath to meet the artistic demand of holding 12 counts versus going, take a big breath and go as long as possible. There are therapy techniques that use that idea of thinking loud and going as long as you can, but we don't generally want to be like, take this kind of breath. We want to focus on what the target is. Is our goal to go as long as you can? Is our goal to go 12 counts? Is our goal to do a beautiful melisma on our breath? So focus on the task or the target. So some of the concepts for this is that we want the student or the client to be reporting on what they notice. So self-discovery versus specific directions. I give the instructions for what to explore, but then they tell me what they notice about it. We may be changing people's understanding of their body map or how they think they breathe. And that can be really interesting to find out what people thought or how they expected their body to work. We tend to try and make the body work the way we think it does. We want people to notice the sensations. Again, build that kinesthetic awareness of what they're doing rather than thinking, I need to take a big breath or I always need to move my abdomen a lot. And then these are things that we're going to return to in order to build that awareness and help people build the motor skills. But we're not necessarily breathing like, I want somebody to do these and breathe longer. You want somebody to do these and know how to take a breath or how to change their breath. This is about motor learning, and it takes that self-discovery. It takes errors and it takes time. So it's okay for people not to be perfect. In fact, we don't want them to be perfect in the session because we need them to go out and explore it. When we want to be working for speech and singing to build skills for those, whether someone has a disorder or it has a typical voice, we definitely need to connect breathing to singing. We need to have the specificity of practicing breathing in the context it's going to be used. That brings us to our third section, which is using the breath as a tool to manage the voice and upper airway. I'm specifically looking at this as rehabilitation exercises. However, the concepts can certainly be used with a typical voice. Keep in mind that if you're not a speech-language pathologist, then you can't use these things with people that have a disorder. So you might be aware of them, you might apply them for your people with typical voice to help them achieve things. But if someone has a voice disorder, they need to be working with an ENT, a speech pathologist, in conjunction with any voice or singing training. So we're going to talk about using the breath as a tool, and in the first case about maintaining the open airway. Because that's actually the most important thing that our larynx does, is it keeps our airway open so we can get oxygen. Almost everything takes precedent over that. So what do speech pathologists have to do with keeping the airway open? Well, there's one disorder, paradoxical vocal fold motion, also called vocal cord dysfunction, where the vocal folds decide instead of staying open when we're breathing so we can get air in, they're going to close. So if you have closed vocal folds and you try and breathe in, everybody try it. Think, close your vocal folds and breathe in. You either get no air or you get stridor. Okay. This can happen when people are just sitting there, not really active. It can happen with exercise. It can happen with elite athletic performers. And it's a problem because what do most of us do when we can't breathe? We panic. So what happens is once people finally get diagnosed with this, we can work with them as speech pathologists to learn breathing patterns, learn mental thought patterns to help manage this disorder and eliminate, ideally, the vocal fold closing when they're trying to breathe in. I'm going to talk about some basic exercises and then point you the direction of some other techniques you can do. The way I've generally worked with this disorder is start with exactly what we just did, awareness of breathing, and also the awareness that we can kind of valve at different places. So we can close it off at the lips, we can close it off at the larynx, we can get really stiff and hold things with our lungs, okay? And then we work on the idea if we need a breathing pattern where we can keep the air moving. So we do it with pursed lips or an SH. So if you think about a shh, breathe in with the pursed lips like that. You can do it without making sound or shh, shh. The idea behind these is that we get the airway open and then we keep the air moving. So those vocal folds will stay out of the way. To get the airway open, we can do some rescue breaths. And I'll introduce one and then talk about the Olin-Ilobi strategy of splitting. So the first two rescue breaths are based on the sniff, which we practice with the snuff hiss. So think about having a pulse down here in your abdomen and you're just going to sniff in. Okay? And what we have people do is we sniff, shh, and then do the SH out. So let's do 3 rounds of that. If somebody's running, they should match their activity level. If they're sitting, they match it to their breathing at the moment. If that's not enough, they can double it, so 2 sniffs. And again, we want to feel the abdomen moving, so there's an inhale both times. Gradually, the person can move to not doing the sniffs and just doing the SH or pursed lip breathing and get back to a normal, comfortable breathing. There's the Olin-Ilobi system. There are 7 steps to that. We're just going to look at one of them because it relates to that idea of the rescue breath or doing something to get the air in. And I find this idea for their step number 3 of splitting to be really effective for people and sometimes very helpful just to get people's awareness of dropping or getting the breath in. So step 3, which is splitting the air, combines a high resistance task to the airflow with a low resistance task. So you do something that makes it really hard to bring the air in, and then you open it up. You can do this with your tongue. So breathe in through your mouth and then drop your tongue, or breathe in through your nose, then drop your tongue to breathe in through your mouth. Okay, kind of feel the air pop in. Try that again. Okay, and that's that idea. We get the high resistance going, then we open up and get the breath in. My favorite is tooth. So you want to bite your bottom lip like you're making an F sound, and then you're going to open it up partway through the inhalation. Okay, I find that gives me a really good sensation of the air coming in. You can also do it with the lips, just pursed to open as well. So try that. Okay. There are, again, 7 steps to that system. So if you want to do it therapeutically, I would go look up the articles and check out all the details of it. For illustrative purposes, I really like this one moment. There's also the Buteyko breathing system, and you need to be certified and have training in that. It has been successful for helping people with paradoxical vocal fold motion. In addition to vocal cord dysfunction and paradoxical vocal fold motion, I've sometimes found these exercises helpful for people with vocal fold paralysis, either unilateral or bilateral, but in a paramedial position. I had a client with bilateral vocal fold paralysis that was discovered when she was in the hospital for some other things, that she woke up every morning, had no voice, could eventually get it going, but kept having episodes where she felt like she couldn't breathe at all. And so what was great is she could get the vocal folds close enough to phonate, but they were so close that breathing was more difficult. So she was able, with the Ilobi tooth, to get the feeling of more openness and use that to help calm down and manage her feelings about not being able to get the air in. So that's using the breath as a tool to manage the airway. Beyond that, we also use the breath to manage or modify a lot of physical behaviors with speech. And I'm actually going to start with some things that aren't specifically voice or voice therapy, because this is where I find, again, the students would get lost on me. These weren't breathing things. These were for stuttering or for voice quality or for dysarthria. What does that have to do with breathing? Well, it has to do with breathing because we're talking. So with stuttering, there's one strategy called an easy start or easy onset or relaxed easy phonation. And you use an H. You use starting the breath flow before you start talking to avoid the tension or tightness that leads to disfluencies. So if somebody was like, Tom went to the store, they get caught on their T, you can change it for practice. He went to the store. Everybody try that. Tom went to the store with lots of pressure. Tom went to the store. Now, with an easy H, starting the airflow first. He went to the store. Your turn. He went to the store. Okay? So we can find that flow. We can find that ease to get in the phrase. But the goal is for people who stutter to be able to use the words they want. So not say he with an H instead of Tom. So you can use that H to still start the phrase with Tom. Tom went to the store. So try that, letting air flow before you make the T sound. Tom went to the store. So we're using the breath as a tool to get the air moving and prevent breath holding and prevent tension to allow people to keep talking with more ease. Another behavior we may want to modify is authoritative voice or pressed voice. So when clients have vocal process granulomas, which are irritations on the arytenoids because they've been pressing their voice together too strongly, we again want to ease that pressure or the vocal folds coming together. That's another place where coincidentally the H works beautifully. So you can work on starting phrases with H. Hi, how are you? Try that. Hi, how are you? Because we don't want to get that impact. You don't have to end up with a breathy sound, but you might have to start with that much H and that much breathiness in it to get a person to be able to eventually do, hi, how are you? Instead of, hi, how are you? A pressed tight sound. And that will, again, reduce the impact of the vocal folds. We get easier, more relaxed phonation. Another way we use the H is with gender-affirming voice therapy to modify the voice quality. So with authoritative voice, we may still want a voice that has a really strong tone to it. With gender affirming, one of the things we know helps with voices being perceived as feminine is a little bit of breathiness. So you can use that idea of easy onset or light articulation with an H to get a breathy sound. So in this case, we're going to say, hi, how are you? But we want that breathiness. So try that again. Hi, how are you? Great. Hi, Hannah, how are you? Great. So we're letting a lot more breath or a lot more air come through. We're modifying the vocal folds so they don't close completely. And that ties into the idea with dysphonia of confidential voice therapy. In that case, while the vocal folds are recovering from nodules or from muscle tension dysphonia, we want to reduce the contact. So we may encourage people to use a breathier voice as just a strategy for managing it. We don't want them to stay with that permanently, but we'll use it as a tool in the beginning to reduce that strain or stress of vocal folds coming together too strongly or trying to close around the nodules with force. So with that, just an easy way to think about it is the idea that you're talking to someone very close to you and you're telling them a secret. So think about telling a secret to somebody next to you, and then let's whisper, I really have a hard time paying attention to videos when I'm watching them all day. I have a hard time listening to videos when I watch them all day. And I agree with you completely. That's no secret whatsoever. So again, we're modifying the behavior. We don't want people to bring the vocal folds together quite so strongly. Okay. We can also use our breath to address dysphonia through the accent method. That very much is using an abdominal breath where we want the clinician to be modeling what we're looking for from the client. So in this case, we're going to take a deep breath and then make an S sound. And I'm going to model something here because I'm getting gloppy, right? You can also use your breath to do a relaxed or easy breath-based throat clear. So instead of slamming my vocal folds together, I'm going to use my breath and say, eh, 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 eh. So I've used my breath to kick the mucus off the vocal folds and swallow it, rather than slamming my vocal folds together with the throat clear to clear the mucus off of them. So we'll just go back and forth. Sorry that my cues got a little confusing. The idea again is that we will continue to go with that back and forth between the client and the clinician, imitating and repeating those sounds. So we very briefly threw in there a compensatory strategy for throat clearing. If you want people to reduce a chronic cough or reduce throat clearing, you need to reduce the irritation of the vocal folds. And there are lots of substitute behaviors that can be used. So instead of coughing or throat clearing, you take a drink or you swallow, which you notice me trying to do. And then there is that breath-based throat clearing to again move the mucus. So I'm just using my breath, trying to blow things off the vocal folds. Another way we can use the breath as a compensatory strategy is with dysarthrias. Dysarthrias are acquired articulation disorders. So when people have spoken normally, but things have changed due to a stroke or a head injury or a neurological disorder, their articulation can be indistinct. They can be too soft. The rate can be too fast. They can sound slurred. And what happens then is it's hard for people to understand the individual. So it's harder for them to talk and then harder for people to understand them, which creates all sorts of difficulties with communication. There are two things we can do with the breath that help with this. One is pacing, one is intensity, or increasing the breath intensity. So if we use the breath for pacing, we're often teaching people to breathe every 3 to 5 words, or whatever works best for them. So if I were to say the phrase, my name is Louise Pinkerton, I can do it just fine because my articulation and breathing all works. But if it's very slurred and I'm talking too fast, my name is Louise Pinkerton, it's much harder to understand. So if somebody were having that kind of difficulty, what we would say is, let's break it up. Let's say, my name is, take a breath, and then do Louise Pinkerton. So we're all going to do that. And I want you to take a breath with me and then say your own name. So my name is Louise Pinkerton. We don't necessarily tell people to be more articulate or to be louder, but oftentimes those can be things that come with it. But it slows people down so they're more intelligible, more comprehensible, which is great because then you can let people know your basic wants and needs, and they're more likely to talk to you back to you because they can understand you. Let's play with this with a longer phrase. So the longer phrase is, I went to the store last Friday to buy groceries for the week. And we're going to break it up. I went to the store last Friday to buy groceries for the week. Note, in this case, we're breaking it with clauses. That works really well because it helps the listener understand. So we're going to do, ready? A breath. I went to the store last Friday to buy groceries for the week. And that can really help with clarity and comprehensibility. Another cue we may use for some of these folks is the idea of talking louder, taking that breath, whether it's for pacing or in general, and talking louder. So my name is Louise Pinkerton, if I'm very soft. Again, with the loudness, we get a lot of other things. We get a slower pace. We often get better articulation. We get more phonation. That idea of talking louder can be something you teach as a strategy that the person can use when someone in particular is having trouble understanding them. Or sometimes we use it to address the whole issue of dysarthria in their entire communication. We're going to start looking at those techniques by looking at Forte. Forte is a system that's used for Parkinson's disease and presbyphonia to help get a louder, stronger, more understandable voice. So we have a weak voice in both cases. The target is the idea of being loud. We want the vocal folds to make stronger contact. We want the person to put more energy in what they're doing. But in this case, we target the idea of loud. Now, if somebody's going to do this for Parkinson's disease, the intensity has to be really high. So it'll end up being 3 to 4 days a week because with the neurological changes, we need that. For someone with presbyphonia, I find once a week works just fine as long as they're consistent with their practicing. So let's go through the Forte exercises. This is one version of working with loudness or intent to address a weaker voice quality. And these exercises, there are multiple. We'll go through the first 4. The first one is we want a loud, intentional ah. So let's do this with me. And those are repeated 10 times to get the exercise that we need. Then there's a set of counting to 10. And on each number, we're going to glide up and glide down. So I'll do 1, and then I want you to join in with the rest. 1, 2, 3, 4, 5. And I think you've got the idea. But you would go to 10 on that with a client. The next one is you work on functional phrases. And I actually do functional phrases with almost all of my voice clients as a way to get carryover for what we're working. Here, they're a fundamental part of the treatment protocol. So with Forte, you're going to say these functional phrases as if you're calling or yelling over the fence. So, how are you? I'm fine. Get the phone. Where are my glasses? And then you do them low and energetic. How are you? I'm fine. Get the phone. Where are my glasses? So we're having people use a deliberately loud sound. We want to build a habit of putting more energy in what they're doing. Now, we have 2 programs that require certification that also address Parkinson's disease specifically. That would be LSVT Loud and Speak Out. Both of those work and have good evidence for Parkinson's disease. And they're a more intense schedule. You're going to be meeting 3 to 4 times a week for 4 weeks. And then both of them recommend a maintenance program because with Parkinson's disease, we know if we get people's voice working better, we need to keep it there and reinforce it. So that intensive therapy helps counteract some of the neurological changes. Doesn't fix it, unfortunately, but it helps people produce a voice that can be heard and understood. LSVT Loud can also be used with adults and children to address other neurological disorders. They have research relating to multiple sclerosis, cerebral palsy, Huntington's, autism, and so forth. I've had the opportunity to work with some clients with Parkinson's disease as well as some of these other neurological disorders, and it's been helpful. So what we've just talked about here is a wide variety of ways we use the breath as a tool across speech-language pathology. We're addressing a deficit or a functional issue. Something is wrong. And what we're trying to do is develop new sustainable changes in motor skills. We've combined it with speech because we need to be specific and make sure people are using the breath in a way that helps them communicate. Some of these systems require training and certification, so if you don't have that, you shouldn't be offering that therapy by name. And just a reminder, for most of these, to provide therapy for someone with a disorder, you do need to be an SLP and you do need to be licensed in the state that the client is in and that you're in. Many of these concepts or ideas, though, can overlap to performance voice. Again, if someone's too tight or producing a pressed sound, using an H is equally applicable in that setting. And we use lots of phonemes, use F to get things going or get the air moving, which is, again, using our breath. The last section we're going to do is about enhancing the speaking and singing voice. So we're starting with the healthy voice, or we're starting with the normal voice. And some of the things I've found as I've moved from being a voice teacher and a singer to being a speech language pathologist is that there's really not a magic breathing exercise, and there's no one right way. When I was a student, the impression I got from my teachers is you always had to take a great big breath all the time, and breathing was work, and there was a right way to do it, that you should do it every single time that way. Maybe that was me as a student, but there is no right way. There's the right way to fit the context of how you're using your voice. If somebody's in a show and they have to scream, they're going to breathe differently for that than they're going to breathe for reporting or presenting the rest of their lives. If you have a short musical phrase, you're going to breathe one way versus a long musical phrase. So you need flexibility with the breathing. Again, breathing to meet the musical demand. And I think that's one of the important things to keep in mind with singing and speaking exercises for performance is that the goal is the performance. The goal isn't doing the breathing. So if we focus too much on how to breathe and we don't focus on what the end result is, we tend to add tension and get stilted performances. So to help the motor skills, focusing on that target, whether it's the volume, whether it's the shaping of the line, whether it's the expression or being able to get all the way through the phrase, that's what our goal needs to be, not that you took a particular type of breath at the beginning. I also think with more advanced students, we need to be careful and not provide so much mechanical instructions. We want them thinking again about the target and maybe helping them a little bit to self-explore and figure out what they need to do or change, but not as much take a deep breath, feel your abdomen, focus on what you're looking for. And then the last thing that's changed is that I am much more specific about what the physical movements are. And I know that contradicts what I just said, but I am using a lot less imagery and I use a lot less studio jargon, words that people in one particular voice studio will understand because that's how their teacher describes things. If I'm consistent in describing what I want physically in clear language, then people can get it without being my student for a long time. They don't have to learn all these special terms. And sometimes when I've developed a term that makes sense to me, it may never make sense to my students. And the last thing is, as fun as metaphors and imagery is, there's actually research that shows that we will retain the imagery, but we don't necessarily retain the physical behavior. So I really like people to concentrate on the sensation and memorizing what they feel. So those are some of the things I've picked up and I've changed with my way of thinking about singing for performance. Now we're going to go through a couple of vocalises and some of those ideas here. These are not specific exercises you should necessarily go out and give to all your students. See if they make sense. Bring the ideas or the concepts into the ones you usually use. I think that's more important than saying these are breathing exercises. Okay? So the first idea is that you need to do things that are contextually connected to speaking and singing. So for many, many years, I did an exercise of Richard Miller's, which you breathe in for 5, you sustain for 5, you exhale for 5 on your breath. So everybody try that. Actually, what sustain means is you just kind of hold. I hate the word hold. You remain open, not breathing in or breathing out. Vocal folds are open, throat is relaxed. We're sustaining that moment of inhalation before we then turn it around to exhale. So let's breathe in, 2, 3, 4, 5, sustain, 2, 3, 4, 5, and exhale, 2, 3, 4, 5. Great. So he recommended working that all the way up to 12. I don't think I ever got any of my students to 12. And I don't use this one anymore because fundamentally it doesn't connect to speaking or singing. And I don't need my students to be able to breathe in for a count of 12. because that's what we're training here. We're training here the ability to sustain, the ability to breathe in for a long time and exhale for a long time. Those are not tasks we need to do for performing. So what you want to do if you like things along those lines is connect it with a phoneme or a sound of ah. And even more so, I would say connect that sound with a musical shaping goal. We want to do a little crescendo and diminuendo, so we've turned it into a messo di voce exercise. We want to do a crescendo. We want to work on straight tone to vibrato. So again, I would definitely recommend if you like breathing exercises that are just working on breathing, remember that what you're working on is breathing. You're not necessarily going to get the transfer to speaking or singing. The next idea is that we want to focus on the outcome, not the process. So we want to focus on the artistic goal or the musical goal rather than the process of breathing. And we're going to look at this with the idea of messa di voce, so starting soft, getting loud, getting softer. And we need to make sure our students have a good target. I think one of the reasons with classical singing, we get a lot of early students that don't put enough energy or volume into what they're doing is because they don't have a good model for what we want. They're singing loudly for them, but not in an operatic loudness because they really don't know. So the students need to know what the target is, and then they need to focus on that. And you can give them cues to reach it and watch for tension and manage it that way. So let's do some messa di voce with the speaking voice. First, what we're going to do is we're going to do 4 different volume levels from soft up to loud, as in across the parking lot calling for somebody. And we're going to say, hey, you, and then hey, you, back down. I'll demonstrate it once and then we'll do it together. Hey, you. 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 I'm not thinking that I need to change my breathing for each of those. I'm thinking about, again, the outcome or what I want to produce dynamically for each of those levels. If we were to do that with singing, again, the same idea. We target what we want, which is the crescendo and diminuendo, and we can work from there. And we're going to do ma, me, mi, mo, moo, and on the oo, we're going to crescendo and diminuendo. Don't get any louder than you can make a comfortable sound. Don't get any softer than you can make a comfortable sound. Let's, ready? Ma, me, mi, mo, Sorry for those of you that aren't sopranos. That's just where it fits best for me to demonstrate. Feel free to take a break and do the couple of those in a range that fits better for you. But it takes really good breath control to be able to manage the intensity like that. So I really like all sorts of different messa di voce exercises in all sorts of different ranges and places. And the last concept with breathing and typical healthy voices for performing is the idea of gauging the breath to the vocal task. You need to take the right amount of breath at the right time to do the task you need to do. So again, we're focused on the task. We're not saying, I need a big breath, I need a little breath. We're taking just what we need. One way to do this is to work exercises with different length phrases. There are a lot of different options in classical music for pedagogues that have put together many, many exercises putting these demands. Okay, so we're going to do he, up and down 5 notes, and we're going to do short breaths as we need and longer note as we need. So let me demonstrate right here. He, he. And we'll go off. He, again. He, he, he. want you to pay attention to the size of breath you take and just notice how it varies. So you naturally take a slightly bigger breath when you need to do the run versus when you're doing the individual notes. Not all of those exercises or vocalises really put a musical demand or reason for those short breaths. And yes, they're working technique. Yes, they're working how to sing. But if we want to focus on the goal or the target, which is artistry, I think doing vocalises made out of challenging passages from a student's current repertoire, from old repertoire, from things that their voice type might do, could be more effective. If you look at the tradition with instrumentalists, I started as an oboist, so I've made multiple transitions here. You don't go learn a Beethoven symphony at the whole oboe part because there's plenty of places where you're holding long notes and blending with the flutes, or you're doing not pa-pas in Beethoven per se, but you're doing things that aren't that complex. What you do is you focus on the solos, or you focus on the duet moments where you're really exposed. And so that means people are learning the breathing and the artistry all together as part of learning that excerpt. And I wonder if that might work well for singers, because that adds the specificity we need for motor learning as well as the complexity. So it's a thought. If you have students that are having trouble with a particular phrase, or they never did get this certain skill mastered in a song, you can make a vocalise out of it. With that, we have some pedagogues who have written books like Sieber and Vakai that are built around that idea. They're specifically targeting certain skills, but they're more musical. You even have accompaniment and things like that. So I really like some exercises put together by Anne Peckham, where they're written in style. They're a little bit longer, so they put more demands on. And I'll do one that shows you the need to take quick breaths. But again, a lot more fun this way. Da da ba da, do you do a da 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 ba da, do you do a da 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 ba da, do you do a da, do you do a da 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 ba da, do you do a da da ba da, do you do a da da ba da, do you do a da do you do a da. So we have all those quick breaths that need to fit in there, all the demand of the flexibility. But to me, it has a little bit more life or a little bit more interest than some of the exercises where it feels like we're just drilling a skill and we're carrying over more into music. Thank you for joining me today for our talk about breathing related to performing and rehabilitation. We looked at breathing from a different perspective of how we use it for mindfulness and managing our emotional states. We looked at ways you can help people build their kinesthetic awareness of breathing. We looked at the way the voice can be used as a tool across speech-language pathology to help people address disorders or problems with their voice, stuttering, or articulation from dysarthria. And we also looked at some considerations for creating vocalises or using vocalises or working with breathing in the context of healthy voices for performance. If you have any questions or want to be in touch with me, I'll put up a screen in a moment that has my email on it. And I also have a YouTube site that I will put up where I have some different videos of breathing exercises, voice exercises, and things along those lines. Again, thank you for joining me as we talked about breathing today.